Let's jump on to COVID because it's been nearly 2 years since the outbreak of COVID-19. From Chinese central city Wuhan, the virus has spread to all parts of the world, with Ghana recording its first case in March 2020. So far, 154,000 people have been infected in Ghana, with a death toll of 1,350. It has had devastating impact on the economy, with budgets put under extreme strain. There have been 4 waves during this period, with the latest now flattening. So what is the future of this pandemic? Will it end at some time? Remember, there have been deadlier pandemics which came to an end. Talk about the smallpox pandemic, which killed more than 300 million, measles, which killed 200 million, Spanish flu, with 100 million deaths, Black Death, which killed 75 million, plague of Justinian, HIV/AIDS, the third pandemic, typhoid, cholera, and Hong Kong flu. COVID-19 has so far killed 5.5 million people around the world, far less than the others have done. So how do we approach this pandemic to restore some order in our economy, society, and the world at large? Today, we've put together experts to help us look ahead of COVID-free future for the country. My guest for this conversation, Dr. Michael Owusu, is virologist at the Kumasi Center for Collaborative Research, KCCR, and a lecturer at the KNUST. Dr. Thomas Anaba is Executive Director at the Africa Center for Health Policy Research and Analysis. He has also joined us. And Dr. Kwame Amponsah-Achiano, who is Manager, Expanded Program on Immunization at the Ghana Health Service. I'm grateful for your time, gentlemen. I'll start with our current situation as a country. Dr. Achiano, where are we now? All right, so I'm told Dr. Achiano is not in yet, but definitely Dr. Michael Owusu has been working in the labs. He knows what's going on. Where are we now, Dr. Michael Owusu?
Good afternoon to Aisha, and good afternoon to all the viewers. So, talking about where we are now, we have been through what we call the 4th wave, and currently, if you have looked at the numbers, we seem to have passed our peak points, and we are beginning to record a reduction in the number of new cases, and consequently a reduction in the number of active case counts. Across the regions, in Ashanti region currently, the number of new cases that we record almost every day has reduced. Currently, we are doing something around 20 to 30 per 100 tests from the community. And that's at this morning is going very, very low. Among travelers, for instance, the rate is about 1 to 5%. For all the travelers that come to our facility. So, as we speak now, the numbers looks good, and it looks as if we are getting through this. Through this wave, and things may normalize, and the numbers will eventually get to 0, and things will be fine. From what we see about the trend of the virus.
Well, some few weeks ago, we were here lamenting over the upsurge of Omicron infections. Has it reduced, or we still have the Omicron dominating infections?
Well, in terms of, the variants, of course, for all positive cases that we are seeing, about 90% of these positives are due to Omicron. And that is what is known. But as we know about the virus, if it's run through the population, it reaches a saturation point where many people become immune, many more are already infected. And when it reaches that point, it doesn't go up again, and the number of infections and rate of infection automatically begin to reduce. So yes, it is still Omicron, but then because it has reached its peak point and almost the virus, we say, satisfied with what it's supposed to do, we are fine. And from now going, we wouldn't see surges like we used to see. So what we have to be looking out for is perhaps another variant. So if a new variant comes in that is much stronger than Omicron, then we will start the cycle again. But for now, it's still Omicron, but then it has reached a point where it cannot cause active infections like we used to see some couple of weeks ago.
Already we're hearing of a new variant in France, the IHU or IHU variant. How deadly is this variant, and whether it's not even here already?
Yes, I mean, I've looked at this variant. It also has quite a number of mutations, a bit similar to Omicron. But then this is a variant under monitoring. It hasn't yet assumed the status of a variant of concern. And you know that variant of concern have about 5 classifications. One of them is that it must have high level of transmissibility. And 2 is that it should be able to cause severe disease and death. It should be able to affect the current therapies which are in place. It should have impact on the preventive measures in terms of the non-pharmacological interventions. And they should be able to affect the diagnostic capacity, in terms of ability to detect them in the lab. So this variant from France has not fully fulfilled these criteria. And therefore, WHO has not come out to declare that one as a variant of concern. So now it is a threat, but it doesn't look like it will have the capacity like we have seen for Omicron, for Delta, for Alpha, and then for Beta.
So it's good news that our figures are declining, and just as Dr. Michael Owusu rightly said, it looks like we've overcome the 4th wave. Dr. Anaba, what could be accounting for this success once again? Dr. Thomas Anaba, are you on? Kindly unmute for me, Dr. Anaba. All right, so we need to check Dr. Anaba's line and then see what the problem is then. But I can still put that question to you, Dr. Michael Owusu. What could be, what is accounting for this success that we've chalked recently?
Factors, some of which are unexplained. One of them could be due to population genetics or immunity that is unexplained as we speak within, especially the African populations, that we cannot tell why some of these variants cannot run through the population and cause disease as much as we see from a lot of the Western world. So this is something that those studying immunology will have to help us to know exactly why we are a bit robust when it comes to dealing with viruses of this nature. The other thing could be some level of vaccination might have helped to reduce the impact of these variants, although we still have not reached the target, but then it's still substantial enough. The other is because of the nature of the virus. So this virus called Omicron lacks certain characteristics, compared to the Delta. So it is able to cause disease, but then it's quite mild, and it cannot enter through the lung cells to cause severe lung disease and infection, which is why we didn't hear much about dependence on oxygen or requirement for people who need oxygen to survive. This variant did not seem to characterize this current variant we have. So a number of factors has contributed to what we see now. And the good thing is that it seems to have behaved like the normal common flu that we usually see, what is typical of this. But we have to be careful because the next variant that will emerge, you can't predict, which is why we always advocate that things like vaccines are still important, not because of the current variant, but because of future events that are unpredictable. So it is better to keep our systems more robust and immune to prevent any form of subsequent infections that may occur from wilder and much stronger variants of this nature.
Is Dr. Anaba back? If you're back, I just want to do an assessment of the country's approach to dealing with this situation. How would you describe it?
I barely hear. I think the network is very, very disruptive. I barely hear your question.
So we would have to fix your line so that you can hear us from the studio. Then we can have a conversation. Dr. Michael Owusu, we've seen a number of pandemics, and we've seen the kind of deaths it has caused. You talk about the Spanish flu, the words, the smallpox, measles, and what have you, you've realized that the number of deaths recorded are even more. The COVID-19 deaths are far less than these deaths. So the question now is, where are we going from here? Does it mean that we would have to record more deaths before we can now come back and declare the pandemic over? Or is it over until it's over?
Yeah, so I mean, that's quite interesting. If you have studied the pandemics that we've had before, especially pandemics due to viruses, it was because, I mean, the world was not wasn't much prepared as at those times compared to now. Technologically, we were not that advanced. We could not study, we could not understand, we could not address some of these situations. So the smallpox events that we spoke about, polio, and many other pandemics, we didn't know what we were dealing with. So it had to kill several people before we finally got to know what we were dealing with. Look at Ebola as an example. It killed many people before we were able to discover the virus. But because of our capacity to sequence these viruses, we are able to come out with laboratory assays that can detect, design vaccines, design drug therapy. So this puts us much ahead, some way ahead of this pathogen, which is why we are seeing low deaths now compared to before. And we seem to have much capacity to detect early, to put in policies to study the behavior of the virus in a better way than before. So talking about when this will end, personally, I don't think that this virus behavior is going to end now. But perhaps we will not talk about pandemics, but we will be talking about seasonal infections, which is due to respiratory organisms, like we see in many countries. So we'll get to a point where, I mean, if almost every season, especially during the cold and harmattan season, if you have flu and you cough, 10% of that could be due to SARS-CoV-2, and the rest could be due to other viruses. So that this may not necessarily cause death, but you may have mild illness and some flu cold. So, and I'm quite confident this will go alongside with the vaccine coverage. So if many countries are able to cover the vaccines and we have huge populations vaccinated, then naturally we are going to be more immune and therefore weaken the effect and the impact of the virus. This is what the world is preparing towards. Until you have full coverage, it will be difficult to say the pandemic is over. But once you have full coverage, then you can say that indeed most of the populations are immune, and no matter how the virus mutates, it cannot go through a wave and even cause pandemics like we have seen before. We didn't know this virus, but now we know the virus. And therefore, once we are a bit protected, I think we can deal with it. So we need to advocate rather in the vaccine direction and get more people to take the vaccine and get a threshold at which point we can consider this as a normal flu and wouldn't want to spend or invest much into addressing it as a pandemic. Get back to a normal life.
Thankfully, Dr. Thomas Anaba has joined us again. Hopefully, the line gets better right now. Dr. Anaba, I'm asking us to do an assessment. First, let's start with our vaccination drive as a country and just suppose it with other African countries. How are we faring?
I think we are doing well. We are not bad at all. We have a lot of vaccines, more than many other African countries, thanks to the benevolence of all those who love us and are donating to us. And I think the government is also pushing hard to get the public vaccinated, to get everybody vaccinated. The only sad thing is that we are not seeing the result of the vaccine as we expected. And then people are still contracting the COVID-19, despite the fact they are having full dose and booster doses upon booster doses getting the infection. That is not to say that the vaccine is not that good, but it has not met the expectation of many, including myself. We thought that getting the vaccine, no one again will be contracting the virus, but it turned out not to be so. As we speak, we don't have a clear, direct indication of how frequent everybody should be vaccinated, not to get it. Is it going to be a seasonal vaccination, or is it going to be a one-time shot of doses, and after that, you'll be taking boosters once in a while? As of now, we don't know. But for Ghana, let me say, we are not doing bad at all when it comes to the vaccination of our population.
Now, aside our vaccination drive, of course, we had a target of 20 million Ghanaians who we wanted to vaccinate. How would you say we've performed with this target? Are we anywhere close to the 20 million?
Close to it, and we hope that we will get close. I think that education needs to go. We need to educate people more, but I think people have the hesitance to read because of the issues that arise from the vaccination. So much of literature abounds in the system to convince people that the vaccine is not working. So much literature abounds in the system that shows that people are getting side effects from the vaccine. But in general, what WHO can say and we can say is that it has tried its best to minimize the severity of the presentation of the vaccine.
Dr. Anaba.
Hello?
Yes, you're still on the pulse.
Yeah. So I'm saying that we have to get people convinced better, get education deep into the public to understand the importance of the vaccine. Once majority of us vaccinate and we get a herd immunity and we get a critical number vaccinated, then it's better. But I think that we should emphasize much on those who have comorbidities because literature shows that they are the ones who are really suffering when they get the COVID-19. We have to get those people convinced to do away with the perceptions they have, despite the negative news that we receive about the vaccine. And some of them are true, but we still have to convince people enough. What some of us do not want to push to is to force people mandatorily to take the vaccine because we think that everybody has this right to either take the vaccine or not, and everybody reads the literature, and then once you take it, you can still get it, and once you don't take it, you can still get it. It doesn't make a difference. So I think that we should rather persuade people to take the vaccine so that it will be faster than putting a blunt law to force people to take the vaccine.
Now, there's been a number of interventions like, abiding by the protocols, the vaccination drive. I mean, the last few months has been very active. We've been very positive with it. And just like you indicated, we've made a lot of headway with that. But the question remains, will we ever see an end to this pandemic?
Will we?
Are we going to ever see an end to this pandemic?
Oh, this pandemic. To be frank, the way the virus is mutating every day and night, every now and then a new variant has come, every now and then a new variant has come. No one at this moment to think that will exit this crisis. We may have an improved situation because of several factors enumerated by the previous person you interviewed. And I think that is one of the things that will help us reduce the consequences of the current pandemic. Science has evolved so fast. We now know treatment for it. Hospitals have been properly resourced, especially in the developed countries. People are taking tests every now and then to see whether they have it. All these things is what is going to help minimize it. But to say that we'll have an end to it now, I beg to differ. I don't think we will. We will have it for long. And what we should be doing is staffing our hospitals with the needed diagnostic materials for every hospital in this country, with enough treatment for it, that we know vitamin C and then the rest are very good for it, aspirin and steroids. We get them stuck in our facilities to make sure that every hospital can be able to test anybody for COVID-19 and treat them as and when they are positive. And we should have guidelines on how people should be treated at home and all that for COVID-19. But to say that we'll be out of the woods now is not possible because, just as you said, there is a new variant which is not yet of concern, but we have to watch it very carefully. We don't know what it will do. And we don't know whether after that variant another one will come or not. So we have to keep watching and be alert that anything can happen, that we are not out yet.
Made significant gains. I mean, listening to the two of you, and of course, listening to the Ghana Health Service Director, Kuma Buaje, who spoke earlier at a press briefing, announcing new measures to help manage our situation. But if we have to live with this, because right now nobody knows when this will end, what should we be doing as individuals? What should we be doing at the government level? Dr. Michael Owusu.
Yes, so at the government level, we need to intensify our surveillance in different ways. One is a public health surveillance, where we continue to monitor clusters of infection, monitor events that may occur at any point in time, even when we are not having active cases, so that immediately you hear of clusters of infections, you can easily quickly move in and then address it. And the next part also is to look at how to intensify our sequencing capacity. And the sequencing is what enables us to know whether we are having emerging variants of concern or not. So you have to put in mechanism to monitor and to ensure that you are able to keep track of this, so that it doesn't escape detection and doesn't cause some unwarranted deaths even before you begin to do. And also when it comes to some of these non-pharmacological interventions in terms of making water available, ensure people wash their hands, and to become more part of our lives, ensuring that mask wearing is still enforced. Until the outbreak or the pandemic is declared over, you still cannot hold back the mask. This still has to be done. And ensuring that, of course, the vaccination is available as much as we can, so that many people will have the opportunity to vaccinate themselves, so that we can keep our bodies at certain threshold and then possibly prevent any form of wave that may come in. So I think if we are able to do some of these, it will help us to be able to put this virus under control, so it doesn't go out of hand and becomes a problem that will affect us economically and also affect our livelihood as people.
There's been conversations about boosters for those of us who are fully vaccinated. I mean, is this conversation very critical as we speak, if indeed we have to survive this COVID-19?
Of course. I mean, it's a conversation that we cannot do without. Already you know that a virus like Omicron is able to break through vaccines, even booster doses, 2 or 3 doses, it still can break through. So the question about boosters is something that we should expect, not just taking it once and for all, but we should see this as something that will be happening annually. Every year, there will likely be booster doses for us to take to keep our immunity at a certain threshold, so that we can deal with any emerging mutations that will come in. Just like we know for the influenza A in the US, for instance, it's still not over, but then every year they expand the vaccine coverage to deal with emerging strains of the virus, so that we'll keep the bodies a bit protected from this. So I expect and I think that it is likely we'll be having annual boosters until the point where we feel that the virus is extinct from the system. But so far as I know, it may not get extinct. It is we, the humans, that will have to boost our bodies to deal with it. So we should expect this at least every year. We should begin to discuss this and to see how best we can implement this fully for the entire country.
What happened to natural immunity? I mean, are we far from that?
Well, you know that natural immunity it works, but it has some level of duration. I mean, we know if you are infected and you have natural immunity, at least from 3 to 6 months, the immune level begins to wane down. So it's not long lasting. And because it's not long lasting, you cannot depend on it, which is why people can be reinfected even if they don't take a vaccine. So before vaccines came in, people had about 2 or 3 infections. And this is because at a certain point in time, your antibody level goes down, and you are reinfected, you are reboosted, and then it goes down. So we are trying to find an artificial way of dealing with this, which is why people are looking at boosters and boosters and boosters. So natural immunity can help, but then because it's not long lasting, you cannot depend on it to protect the population for a long period of time. unless you look at vaccines as an alternative means of having what we call an artificial immunity, where there's some way somehow better than a natural immunity.
Dr. Anaba, what cue can we take from other countries so we can better manage our situation?
I think we are virtually following all what other countries are doing. I don't see what, again, we can take from other countries. What we need is to discipline ourselves and abide by the protocols, get government to make sure all our facilities, as I said from the beginning, are stocked with diagnostic materials to make diagnosis very quick, and also stock with the needed medications to treat people. Once we follow the general protocols, and hygiene, social distancing, avoiding crowds if it is unnecessary for you to go and the rest, we will minimize the spread, and then by that way we will also get our facilities less congested with COVID-19 cases. I think that is what we need to do. There's nothing new we can pick from any other country. We've even passed, we've even instructed that everybody should get the vaccine mandatorily. What again do we want again? I think we are doing all what every country is currently doing. So let's just continue with that, but everybody should collaborate and let's do it. And let's plan to know that this is going to be with us for long. So all what our measures we are going to put in place, all our plans we have for future, to always factor in COVID-19 as one of the problems we are going to be resolving until we get a final solution to it. Hopefully there will be any.
I'm grateful for your time, gentlemen. Dr. Thomas Anaba is Executive Director, ACHPRA, and Dr. Michael Owusu, he is a virologist with KCCR and a lecturer at KNUST. I'm extremely grateful that we were able to make it. Now, I'll take a break on the Pulse. Remember, you can also join via all our social media handles. It's on JoyNews on TV. You can tweet at us with the hashtag The Pulse. We'll be back with more.